From the studios of the Optimism Institute, welcome to the Blue Sky Podcast. I'm your host, Bill Burke, and in every Blue Sky episode, we'll be speaking to leaders, researchers, and thinkers whose stories and insights will remind us that there is always blue sky above. Sometimes you just have to get your head above the clouds to see it. So far, Blue Sky guests have spoken with us from Australia, the US, Canada, and Europe. And today's is our first from the continent of Africa. Ritah Kabanyoro spoke with me from her home in Uganda, where she and many others are doing remarkable work to assimilate and provide homes and livelihoods for the large number of refugees entering their country on a regular basis. In today's episode, you'll hear about the great lengths that the Ugandan government is taking to make this all possible, working alongside organizations like Action Against Hunger, where Ritah serves as Uganda's country director. Ritah Kabanyoro has nearly 15 years of strategic leadership experience in financial and operations management with humanitarian development programs. Before her current appointment, Ritah served as finance team leader for ACF Uganda, where she has led the office to strengthen financial accountability and donor retention. By the way, ACF is the acronym for the original name of this organization, which is, in French, Action contre la faim. Not bad. Before joining ACF, Ritah served in strategic financial leadership positions at World Vision Uganda, overseeing an annual budget of $30 million. In addition, she also served as a senior grants manager for Elizabeth Glaser Pediatric AIDS Foundation, where she provided oversight of USAID's largest funded health program in Uganda. She also served as a grants team leader for the Joint Clinical Research Center, a premier HIV/AIDS organization in Uganda. And there she supervised all USAID and CDC funded programs. Ritah is a certified accountant and possesses a bachelor's degree in business administration from Makerere University in Uganda and an MBA from Heriot-Watt University in the UK. Currently, she's working on her second master's in international development at Edinburgh University, also in the UK. I hope you enjoy this conversation with Ritah Kabanyoro as much as I did. Ritah Kabanyoro, welcome to the Blue Sky Podcast.
Thank you.
Where am I finding you today through the miracle of technology?
Kampala, Uganda, in the Pearl of Africa.
You are in Uganda. So I'd like to start for our audience by setting a context, because I and many other Americans are woefully ignorant about much of what happens in the continent of Africa. And it wasn't until I researched for this interview that I learned that Uganda is the largest refugee hosting country in Africa. Can you help us understand why that is?
So Uganda has a very one of the best progressive refugee policies in the world, really. And under this policy, we allow refugees to come in. We don't do the refugee camp system. We do settlements. We allow them to come in, access land, get access to government services, education, healthcare. Refugees are free to work and blend into communities. And because of that, we've opened our borders to refugees, especially from South Sudan, DRC. We have a few from Somalia. We have some from Rwanda and Burundi. And currently we have over 1.5 million refugees in Uganda, most of whom have been here for over 5 years. And we're still receiving new arrivals every single day. Every day we receive a minimum of 500 people coming in through our borders. And those are the only ones, the ones we're able to register. Many others come in through the porous sides of the borders that we are not able to register. But every single day, a minimum of 500 people come in.
Amazing. If I have my facts right, the Ugandan population is about 45 million, I think. And so 1.5 million refugees in a country of 45 million, that's a big number. And you are bordered by Sudan and the Democratic Republic of Congo. So you're surrounded by countries in strife and conflict. So I'm sure that contributes to it as well.
Yes.
And when these folks come in, I imagine they've got traumatic stress. There's probably language barriers in some cases. How has Uganda become so good at welcoming and getting folks, back up on their feet?
So when you go into these refugee settlements, the one thing you'll notice is there's so many partners, especially NGOs, CBOs, even government itself that are trying to help these people. When you get into the transit centers where the refugees are first received, you'll see a whole kind of people that are there to help them, offering different services. You'll have UNHCR offering them the first hot meal. They've walked for thousands of miles. You'll have UNHCR providing them with items, quick items, blankets, plates, cups for them to be able to access the simple basics. You'll have another partner, maybe medical teams, providing them with medical services. Action Against Hunger will be there, screening for malnutrition and all of that. So it's an expanse of people that are working together to make sure these people come in and they get a little bit of comfort, regardless of how small it is. They get some comfort, they put them into reception centers or transit centers where they're supposed to stay for a maximum of 3 to 4 weeks, and then they are moved into settlements. Government allocates them pieces of land and they are moved there, and then that's when now implementing partners like Action Against Hunger get in. We screen them for malnutrition, put them on malnutrition programs, teach them how to farm, how to earn a livelihood. We work with so many different partners so that everyone is bringing a contribution to the improvement of these people. As I mentioned earlier, our progressive refugee policy allows for a multi-stakeholder approach. So government gives us the opportunity to contribute whatever it is you can bring, because they know we are a country that doesn't have very many resources. We are a low-income country. Even we Ugandans are struggling with basic things. We have high levels of malnutrition. If you look at our global acute malnutrition rates, they're quite high. But that doesn't stop us from helping these people that come in. So we offer what we can, and everyone is free to bring whatever contribution they're able to do. So we take them through processes, and you find refugees who've been here for over 10 years that have settled fully into the community. Most of them are not even intending to go back to their countries. I mean, this has become home. But that comes from years and years of work, years of effort, a lot of effort from different players, different stakeholders, the government, organizations like Action Against Hunger, and many other actors. Everyone is contributing what we can.
That's one of the things that struck me as I learned more about this, that back to 45 million roughly Ugandans, and about a third, I think, are in need of assistance, nutrition, health-based assistance. So I'm talking to you from a country that is so wealthy and has so much, and we're really struggling with how we take in and assimilate immigrants. And it's kind of stunning to hear about a country like yours where it clearly is a partnership, government, NGOs. And I'd like to talk about your NGO, Action Against Hunger. Can you tell us how you got involved? What kind of work do you all do? And then after that, I'd love to talk about your own personal story, which I think contributes to why you're so passionate about this work.
Okay. So Action Against Hunger has been in Uganda for over 30 years. We came in here when there was a famine in the northeastern part of Uganda called Karamoja. It's one of the places that is highly affected by malnutrition, long droughts. It's extremely dry, even today as I speak. So when we first came into the country, there was a famine there and we responded to it. And currently we've stretched to over 10 districts in Uganda, mainly refugee hosting districts. We're mainly working with refugees. However, we have programs that are stretching to host communities as well, because there was a lot of attention being given to refugees because that's where the donors are putting their focus. That's where everyone is looking. And then we realize we're neglecting our own host communities. As refugees are doing better, their livelihoods are improving, their nutrition is growing, the host communities are going down, the levels of stunting are increasing, So we started rethinking our strategic shift and saying, hey, we don't need to focus on only refugees. There are also vulnerable people in Uganda that we need to focus on. The programs we do currently, we do treatment for malnutrition. And that was the core of what we used to do earlier. However, we realized that we were just dealing with the symptoms but not addressing the root causes. So you would treat a pregnant mother for malnutrition today, and when she gives birth and gets pregnant again, the same mother will come in. So then we said we need to rethink this process. Otherwise, we'll keep treating the same people and we'll keep getting new patients. So we said then we need to move into addressing the root causes of this hunger, which are many. Everything leads to hunger in one way or another. So we decided to expand our programs from just treating malnutrition. Now we do food security and livelihoods, which is the biggest, actually, our biggest program here in Uganda, because that's where the gist of the problem is. So under this, we are helping refugees access land. We have a lot of land in Uganda. It's not a problem. 82% of that land is arable. We have 2 rainfall seasons. Basically, we are able to grow food, enough food to feed everyone. So we thought that we need to start helping these refugees access land, because when they come in, the government only gives them a 30 by 30 feet of land, which is a very small piece of land. And on that 30 by 30 feet, this refugee, usually a household of at least 6 people, has to put up a small house, mud house. They have to do a small garden. They have to put a latrine. They have to feed their animals. Everything has to happen on that small piece of land. So you can imagine how much they're able to farm. So we said, can we run a land campaign? And we went to government of Uganda, we went to the host communities that have a lot of land, and we're saying, hey, we have these people that are in need of land. You have a lot of land that you're not using extensively. Can you allow them use it? And from that campaign alone, we've gathered over 20,000 acres of land. And we've allocated this land to refugees. And what we do, when we first start in the program, we will teach them how to do small kitchen gardens at home so they're able to deal with their daily nutritional needs. And after those have been addressed, we get these refugees, put them in large farmers groups of 20 to 30 people. And each person in this group is representing a household of at least 6 people. So we put them in these farmers groups, assign them a large block of land, which can be between 20 to 30 acres of land. Then we give them a comprehensive package, teach them how to farm, give them a starter package, including seeds, and the other agricultural products. We provide technical support to make sure their productivity and yield are high. Then we link them to markets to make sure they're selling their produce, So it's a whole cycle. And from that process, we've seen malnutrition levels significantly go lower in the refugee communities we're working in. And we are scaling up these models, of course, subject to availability of funds and resources to do that. We are scaling them up because it's a model we've seen working. Now, people, if you go to some facilities, refugee facilities, you will not find a mother suffering from malnutrition because everyone is producing food at their home.
It's clear from Ritah's description of her home country that they're doing a terrific job following up their welcoming immigration stance with programs that also help newcomers survive and thrive. While there are countries that for various reasons might keep immigrants out, and others where immigrants are allowed in but struggle greatly once they're there, in Uganda they're given resources up to and including pieces of land on which they can grow their own food. And this from a country where so many of its own people are struggling. It's a very compassionate approach. Getting back to our conversation, Ritah will talk some more about hunger and the many forces that impact this issue.
Everything affects hunger. So we're also doing programs in water and sanitation. This is one area that is not given a lot of attention, especially in poor countries like Uganda, because, people will tell you, I am sleeping hungry, so why do I need to have a toilet? Why would I focus on a toilet when I don't have food to feed my children? It doesn't make logical sense. But we're coming in to say, hey, as we are teaching you how to get food for your household and earn income, we also want you to have these sanitation services, because if you don't have them, you're going to get sick. And whatever you eat will go out of your system. So we're doing a bit of programs under that as well. So those are 3 core programming interventions, but we also do a bit of advocacy, though on a smaller scale, because we don't have so much, really, we don't have a lot of audience for so many other more pressing needs. By the time you start saying we need to change this and that government system, are the people eating? Do they have water? A policy can be done, but if there's nothing that's going to implement that policy, then there's no point. So we're pushing for advocacy on a smaller scale, and we're growing that program as well. But at the core, at the heart of what we're doing is treatment for malnutrition, food security and livelihoods, water and sanitation. That's the focus of what Action Against Hunger does in Uganda. And every single year, we're reaching over 600,000 people with these life-saving programs and all of that. And if you look at our data, we're seeing these very people that we've moved with for a year, 2 years, 3 years, you see a total life transformation. From a very small investment, someone's life completely turns around. We have refugees that have started very good businesses here. They're earning income. Their children are going to school. The children are not falling sick anymore. A single mother of 5 children is able to sustain her household from a very small investment of about $112. Really, that's majorly what we do here.
That's a lot. So I'm trying to take this all in because there's so much in what you just said that is so striking to someone sitting where I'm sitting in this country. And everything you said, 20,000 acres of land. So did you raise money to purchase that land? Was it gifted to you? How did that transaction happen? First question. And then how were you able, one of the things we don't do well in this country is preventative health, preventing people from getting hungry. We feed hungry people, but we don't think about more upstream. How did those things come together?
Okay. So with the land, it's really a negotiation. Uganda has a lot of land, a lot of it. If you come here and if you're looking for any place to retire and you just want to find things ready, Uganda is your place. We can give you land, we can give you a wife, we can give you children, whatever it is you want, we have.
Yeah.
But so how we've acquired all this land is simple negotiations. Go to government and say, hey, you have this piece of land that is reserved and it's not being used. Can you allow these refugees use it for the next 5-10 years? We go to host communities. We have landlords who have over hundreds and hundreds of acres of land, hectares of land. And we go and say, can you give us 30% of it? So we can have these refugees use it. And in cases where we are asking host community members, we agree on a repayment mechanism, which is usually in forms of food. So these landlords will tell you that if you're going to use my land for farming, because refugees don't have cash, at least
Right.
for the starting point.
Sure.
So they will say, if you're going to use my land for agricultural production, 10% of your produce will be mine, and that will be your rent payment.
Okay.
So the landlord will get food, whatever that they've not worked for, they're able to sell it, they're able to feed their households, and the refugee gets the 90% of this land. So that's how we've acquired most of it. Government of Uganda, we go and negotiate and say, hey, we have these technical models that are working. This is the evidence you produced. This is what they've done for the country. This is how they're helping the refugee situation in this part of Uganda. We need more land. And government is very open to it. Even now, if we wanted to have much more than 20,000 acres, we're able to get it. It's just that we're being careful not to accumulate a lot of land that we may not be able to put to use right now because of limitation of resources. But the land is very available, really.
And this philosophy of prevention and being proactive, is that something that's a cultural thing in Uganda? Is that something that you and your folks at Action Against Hunger have brought to this? Where would you say that comes from?
I think it comes from Action Against Hunger mainly, because in Uganda, given that it's a very poor country, everyone is trying to survive. It's not about prevention. It's about how do I live to see the next day. If you're here, you would have heard a saying. People usually say being Ugandan is a job in itself, because everyone is trying to survive. Everyone is hustling for this and all of that. So we naturally don't have the prevention mechanism in us. However, organizations like ours, like Action Against Hunger, comes in and says, hey, you know what? Instead of you feeding on this small piece of land for today and then tomorrow you don't have, why don't we teach you how to do, larger scale production? Why don't we put you in a group where you're able to feed your house for the next 4 months? There's a rainy season coming. This is what you should be doing right now to prepare for that season. There's going to be a drought coming. Climate change is here. How can we help you be more resilient now, so that when the climate change effects are more felt, when they become more intense, they'll find you more resilient than you are now. So that's really at the core of what we do. Can we teach them to focus more on prevention than firefighting when the situation hits? And that's where we've been as a country. We have a lot of resources, like I have said earlier, but because people are living in today's survival, they're not focusing more on tomorrow. What happens tomorrow? They find themselves in a crisis, and we're coming in to say, this is how you can deal with today while also sorting tomorrow's problems. You can feed your household today using a kitchen garden. However, you should also be in a farmer's group, have a block farm where you're going to get a lot more food production that will feed your house for the next 3-4 months. In addition, you'll have a surplus to sell and an income from, and that will cover more basic needs for you in the longer term. And the cycle continues. We've had refugee households that were surviving on $35 a month. $35 a month. Imagine a household of 4 to 6 people. And we've seen these families transition from $35 to $420 in one rainy season. We've seen farmers groups earning as much as $30,000 in one planting season. So these solutions are real and they're possible, and people have actually woken up to see that they work.
Ritah speaks confidently and with pride about the work she's leading because she's seen it work. Her organization's efforts have reached more than 600,000 people and helped them meet their basic needs. Refugees are earning incomes in Uganda, and their kids are going to school. Action Against Hunger has worked to secure land for those in need, but is also careful not to ask for more than they need, heading off another potential cause of backlash in a country where so many are doing without so much. As their saying goes, being Ugandan is a job in itself. Given her country's challenges, I wanted Ritah to talk about whether there is any resentment among her fellow Ugandans about the generosity being extended to those who are pouring in from neighboring states. In a country where so many are struggling, do you run into any resentment from native Ugandans about these incredible gestures of generosity that you're providing to immigrants? I know in other countries, including my own, people sometimes resent, the giveaways, the handouts, that sort of thing that are happening to people, that are being provided to people who are coming into their native country. Do Ugandans run into that at all, or is just the mindset different in your country?
We've had it happen. Ugandans are naturally social people. They're very welcoming. They're very kind. They're very, it's a community, really. Everyone is in your business for the good and the bad reasons, So if you come in and you've not encroached on their things, you've left them in their place, and they're very welcoming. They have no problem. However, with the refugees, we've run into some conflicts because, as I mentioned earlier, there was a lot of focus that was being put on refugees. You come in and you're treating them, you're giving them education for free, you're giving them health services for free and all of that, and the host communities are not getting the same attention. Then they started becoming hostile to these refugees and saying, hey, we're the Ugandans here, You'll have cases where they start fighting. You go in and give refugees food. The ones that are receiving food from UN agencies, refugees line up and receive food. Host community members are dying hungry, and then they start fighting, So we've had a bit of those conflicts, but along the way, we've also learned to manage them. That's why we're saying when we go to the host communities, we are teaching them how to do long-term prevention. Can we have you farming? You have the land, you have the resources. Can we have you focus on that long-term solution? But this refugee right now needs food for today. We need to give them a start in life. They've moved from where they've come from. Now they're here. It's not been easy. So we've had to be very deliberate with those programs. We have programs on mindset change. We have programs on peace building, programs on conflicts, conflict management, social cohesion, so that we create a peaceful environment in these communities where the refugees and the host communities are mainly. But most of them, you will not find a lot of conflict if you're giving equal attention to both. So you don't neglect one group and leave the other. Yeah.
Incredible. You bring so much passion to this work. It's clear just from talking to you. And you know what it's like to go to bed hungry. And I'd like to talk a little bit about you. You grew up one meal a day as a young girl, started having fainting spells. I get the sense you had remarkable parents who somehow found a way to get you to private school and work on your education. Can you tell us a little bit about your life story and how it's led you to this remarkable work you're doing today?
Okay. So growing up, we were in a very extended family. And by extended, I mean really extended, to the point that to this day, I'm honestly not sure how many children my father has to this day. You can imagine. But I remember my household had at least 20 people on any given day. So you can imagine us 20 people living in a small house of 2 rooms, 2 to 3 rooms was the maximum we ever had. And while growing up there, we used to have one meal a day. And growing up, it seemed normal. Never thought that I was supposed to have 3 meals a day like I do have now. It seemed like the norm. I mean, one meal a day. Yeah, we have lunch every day, and that's okay, you know. And that was life, and most of that one meal was the same food day in, day out, except for the special days like Christmas, like Easter, those very, very big days when you get to eat rice and you get to eat beef and you get to eat a bit of chicken, maybe a quarter of a piece of chicken. Those were the really special days, and we used to look forward to them. So I grew up in that state, and I was in it until I was around 13, 14, when I finally went into boarding school. And in this school, we were having 3 meals a day, and my system was in shock because actually, the time leading to that, I started having health issues. So I would just be there and lose consciousness. I remember the time I was walking on the road and I would just faint out of nowhere, out of nothing. And also, given that we were very poor, the medical services were not so enhanced. So we would go to a doctor and the doctor would say, "But I don't see anything. I don't see, her body seems to be fine. I'm not sure why she's losing consciousness. I don't know why she's fainting. So I grew up knowing I had a problem. I faint. And my mother had to watch me all the time, make sure I'm not out of her sight and all of that. And we all thought there was a problem with me. Yet the real problem was just hunger. Lack of water in my system, lack of water in my body. So I go to boarding school and I'm having 3 meals a day. Not very nice food, but at least they're consistent. You'll have a cup of porridge in the morning, have lunch, and then have dinner. I was lucky I got a scholarship into boarding school. And that's when reality hit me that, there are people who actually have 3 meals a day. And from that time, I didn't have the episodes of losing consciousness or fainting ever again. They somehow just went silent. So growing up in that state puts you in a certain condition to see how hunger lives with us. And most people who are going through it, if you go to those refugee communities, they think it's okay. Recently, as in one of our locations, in one of the refugee settlements we're in, and I met this mother of 4, single mother of 4, and she has 4 children. The mother herself looks malnourished. All her 4 children look malnourished. I'm not a medical doctor, but I could see the hair is red or brown. Their arms are very tiny. The skin is sunken. You would basically see that these children are not okay. But the mother was happy. She was testifying. She was praising and saying, "I'm happy we're able to feed my children." So I asked, "How many meals do you have?" She said, "We have 1 meal a day. The food rations from World Food Programs have gone down, but we're able to afford a meal a day. We're happy we are." And you're looking at her and saying, "But the situation is not okay, but she seems comfortable, you know. So having grown up in that state and seeing people go through it every day hits a different passion. And when you come to organizations like Action Against Hunger, where you see real-time solutions, we are not just checking a box, not just doing any other program because we have funding. I mean, we have organizations that have been here for years. But when you go to look for impact, sometimes it's not there. But here you're able to see this child who was malnourished when they came in. And with a very small investment, you see their life transforming, the entire household transforming. They're now able to have 3 meals a day. Their children are going to school. They're earning a little bit of income, not so much, but enough to sustain them, enough to move them to the next day. You know, the family is growing and you see that transformation daily. We've seen families that we put in our programs for 3 months, just one rainfall season, and you see a total transformation. They even put up a small concrete house. You know, life significantly improves. So when you're part of that transformation, part of that, seeing that these people are moving from what you went through and they're actually able to change their lives. And this is not change that, you know, when you walk away will stop. It actually continues with them. These are skills they're going to live with for life, even if they go back to their countries. You know, that hits a different level of passion. And for me, it always amazes me that you basic things that you teach them. This is how you farm. This is what you do when you want to have a dietary diversity. You know, we grew up eating mainly vegetables. And I was telling someone the other day that I get surprised now when I watch movies and people are saying, eat your vegetables, eat. Here, all we eat is vegetables, you know?
Hear that, everybody? There's nothing wrong with vegetables. And after hearing the compassion with which Ritah approaches her difficult work, it's not surprising to learn that she had her own struggles with hunger as a child. She grew up with 20 people in her household and doesn't even know how many children her own father had. She had only 1 meal a day, but she thought that was normal. And even her doctors failed to understand that her fainting spells were largely the symptom of simple dehydration and malnutrition. Given that she managed to emerge from these childhood struggles to become a remarkably productive and positive adult, I asked Ritah where she thought her optimism came from.
I believe sometimes there is a blessing in the unknown. That when you don't know how good life is in New York, there is a blessing in that. You know, sometimes people come to Uganda and they say, how do you live here? The roads are so bad. It is so bad. But it's because we don't know any better, you know. So I think in some of those situations, it does help for you to be optimistic, be excited. You're grateful for what you have. I mean, back then, even with having 1 meal a day, we were told you have to be grateful for this 1 meal. You have to thank the Lord for this 1 meal. It's a miracle that you're able to eat every day, you know. So that puts a level of optimism, a level of joy in your heart for whatever it is, whatever little you have. You've got to be contented and happy and thankful for it, you know. But also being that some of these issues are issues that can be resolved without so much, you know. So you look at this family that's doing so badly. They don't have food, you know, they're barely surviving. And you do something small and it changes their lives. It keeps you optimistic about the future, that with so little, you feel like you have control of transforming these people's lives. That as a small investment, teaching them something little, you know, showing them how to do this and that, connecting them to a market or that is able to change their lives completely. You're always optimistic because you know everyone you meet, you're going to have an impact, a positive impact on their lives.
It's incredible. So let's talk some more about Action Against Hunger. What is your funding model? Where do you take donations? Do you get government funding? Tell us about the business model or the economic model of Action Against Hunger.
Okay, so Action Against Hunger is open to. I'm smiling because I've worked for organizations where they've said, you know, anything below $10,000 now. No, thank you.
Oh.
I mean, what can it do? You know, I've seen that happen here. It's considered a very small program, but Every donation counts. In Uganda, I can tell you right now, in Uganda, if you came with a donation of $10,000, we will have a whole project. And we will go and implement it, give you numbers like we're implementing a $1 million project. Anything counts because we know that $10,000 is going to leave at least 20,000 people's lives different, totally different. So we're open to donations from everywhere. We have donors from European Union, we have UN agencies, we have US government, we have foundations, we have individuals. If anyone wants to do maybe a monthly commitment, quarterly commitment, we are open to all of that. So it's a collective effort for us. And even beyond money, other things we look at. Let's say if we are into food security and livelihoods, you have maybe a tractor that you consider is very old. You don't have use for it. It can do a lot for Uganda. We'll open the doors to it. You have in-kind donations, whatever it is, we're open to it. And this way, we are gathering resources so that whatever we get is able to reach someone out there. Nothing is too small, nothing is too much, nothing is so little. We will adjust our systems and processes to whatever. So that's how we raise the funds and resources that we're working with. But additionally, because of a general limitation in resources, especially for the development world, and also countries like Uganda have been deprioritized by a number of donors. Now the focus is on Ukraine, the focus is on Ethiopia, Somalia, and all of that. And yet we have a refugee crisis that is really bad. We're also starting to rethink our strategies and saying, how can we reach more people? We have local partners, they're able to deliver a lot more than we can using very minimal resources. We're saying, can we partner with these organizations? Can we push localization, so that we are able to work through some of these arms to reach more people? If there's an area where we're not able to reach, can we empower community-based organization to do that? Can we work alongside government of Uganda? Government of Uganda will be here many years after action against hunger is not. How can we work alongside them to empower them, build their systems, strengthen their systems, move our technical expertise onto them so that they're also able to provide this support to these very communities for the long term and the longer sustainable way? That's how we are rethinking ourselves right now.
And I've heard you say that there's really no excuse for hunger in the world. And you've said if we could respond to hunger the way we responded to COVID, we could do it. And it really made me think, because I think people take for granted how astounding the response to COVID was in terms of distribution, the creation of the vaccines, but then the distribution. And it was definitely rolled out in wealthier countries first, and there were a lot of issues with that. But still, billions of doses of vaccines around the world. And I imagine, and it sounds like you look at that in awe and think, boy, we could do something very similar to address hunger. Is that a fair way to say it?
Yes, it is. So a CEO of Action Against Hunger recently said a statement that hit me in a very different way. And he said, in a season where we are talking about so much technological advancement, that people are going to the moon for fun, for tourism, season where we're talking about electric cars, a season where we're talking about, internet coverage like never before, mobile phones, chips, and all of that. How can we have 800 million people going to bed every night, going to bed hungry every single day? This is a global problem. It's a problem that can be resolved. This world produces more than enough food to feed everyone. And as I mentioned earlier, for countries like Uganda, we have a lot of land. 82% of it is arable. 18% of our land expanse is covered by water. 2 rainfall seasons. Why do we have 3 out of 10 of Ugandan children stunted? There is no explanation for it, but because we have deprioritized some of these things that are the core of what we should be focusing on. So my call is, if the whole world came together, just like we came together for COVID and said, we're targeting this hunger problem. No one should be going to bed hungry. How do we align our food systems and processes? How do we increase productivity? How do we increase access to resources and even food itself. How do we make sure that everyone has a meal every day and we all came together like we did for vaccines, like we've done for HIV/AIDS, like we've done for malaria, for those big pandemics. If the whole world came together and we held our hands together, a world free from hunger is possible by 2030. And as action against hunger, that's a vision, a world free from hunger. We know it is absolutely possible. And as I've mentioned through this entire conversation, it doesn't take so much of an investment. Just teach someone how to farm. Give them a small investment. Give them the resources they need. And they're able to produce food to feed their children, their children's children for the generations to come. That is all it takes.
Incredible. And one of the hesitations people have sometimes when they're thinking about contributing to an organization like yours is, will the money be put to good use? And this is not meant to be a telethon for Action Against Hunger, but it sounds like you have a remarkable track record of doing a lot with a little. And so it sounds like if, the bulk of my audience is in the United States, there's some from around the world, but if they wanted to give directly to Action Against Hunger, that is something that they could do. Do they go online? Is that the best way to do it? And where can they learn more about your organization than just what they heard in this conversation?
We have giving platforms on our websites. And as you've rightly mentioned, we will account for every dollar. Like I'm not saying this because I work for Action Against Hunger. I have worked for so many organizations, non-government organizations, and I have seen how it works. This is the first organization I've worked in where we are deliberate in ensuring that most of what we get goes to these communities. If you come to Uganda, for example, and you said, I don't want any single dollar of my money going towards admin, the organization that will say no to you right away. They will say, we want 100% of our money going to beneficiaries. We will tell you that is possible. Not because we have a lot of resources, not because, we are extravagant or anything, no, but because we know every contribution counts. And we're able to account for every dollar, put it to maximum use. So yes, we are very deliberate on ensuring that all resources are rightly used, maximum benefit goes to these people of concern, the people we're working with. So we have a number of giving platforms. Our website is there. It has sections where you can make your commitment, put your information. You can write to our incredible team across the world, New York especially. They will get back to you. I mean, even if you went and signed in for a newsletter or updates about our information, you will have updates coming to you every single day. You'll stay updated on what your donation is doing and how much impact it's causing in the world. So we are very, very, very accountable as an organization on every level.
Terrific. And as we get near the end here, Ritah, is there anything I haven't asked you about that you've talked about that you'd like people to know about you, your work, Uganda, anything else?
Just the emphasis that a world free from hunger is very possible. Uganda has been deprioritized by so many donors, because of the protracted refugee crisis we've had. And it's expected, really, if you've had a refugee crisis for the last 10 years, ideally you should have walked out of it. But as I mentioned, even today, as I speak, there are refugees that are coming in that are being registered right now. So the crisis is still on. We had made a lot of progress before COVID, and then COVID came in and set most of these families back to zero. So we are back from scratch. So for anyone out there that would like to make a difference, this is your place. This is the country. People are still here. There is still a lot of need. 3 out of 10 of Uganda's children are stunted. Imagine such a statistic. Even in Kampala, in the capital where you expect resources, the statistics are that bad. So these conversations are absolutely necessary. We need to start rethinking. We shouldn't let these people be stranded and left alone. They don't have a place to go. And we all know what it's like to have to leave your country, give up everything and move into a foreign land and have to start over. So please come to Uganda. Please offer Uganda whatever help you have. But even for other crises across the world, really, we know the situation is bad elsewhere. So we're just saying, please have a heart for these people, for the next person, and help as much as you can. Every for those that are Christians, whatever faith you believe in, I'm sure there is a part that says, please help your neighbor a little bit, work with your neighbor in one way or another. So kindly extend that hand whenever you can. Whatever is possible, we are open and we are happy to have you. For those that would like to come to Uganda, visit our program, see this transformation, see the impact of our work, please come anytime. Our doors are always open. These things that I'm speaking, if you came today, tomorrow, or the other day, you're going to be able to see them live. You're going to see these families, going to see this impact, see the change, the transformation, and you testify about this yourself.
Amazing. Ritah, I am so thankful that you came on the Blue Sky podcast. You are just the type of person we enjoy profiling. You're just brimming with optimism and hope and clearly doing incredible, impactful work. So thank you so much for taking time out of your day to speak with us. It has been an absolute pleasure and privilege to talk to you.
My pleasure as well. And anytime, please feel free to reach out to us anytime. We are happy to have these conversations. We want our voices to be heard. So thank you for the opportunity. Thank you for providing the platform to action against hunger. And we definitely look forward to many more of these.
I was struck by Ritah's use of the expression, blessing in the unknown, implying that sometimes not knowing that others might have it better than you can actually enhance our own sense of well-being and contentment. Now, I never miss a chance to talk about social media, but truly, I do think there's a connection here. There was some blessing, I believe, in the days before social media when we weren't constantly shown others at their best, their latest achievements, purchases, vacations, graduations, triumphs. It was easier not to worry about keeping up with the Joneses when the Joneses kept to themselves, or something like that. Hopefully, you get the gist. Ritah also stays optimistic because she's seen in her country that small things can make a huge difference, that every contribution, donation, and helping hand is improving lives. And she remains determined to continue on because she still knows that too many people still are going to bed hungry. We all can be thankful that there are people like Ritah and organizations like Action Against Hunger who continue to work so hard to do something about this. I hope you enjoyed this Blue Sky conversation with Ritah Kabanyoro and were as inspired by her example as I was. Please let us know what you thought about this and other episodes by leaving us a rating, review, or message on our social media platforms at the Optimism Institute. We would really like to hear from you. Until next time, I'm the founder of the Optimism Institute and host of Blue Sky, Bill Burke, and I thank you for listening.